guys, it's Maggie Midwife with Wild Fig Birth. Hey, I'm going to talk today a little bit about gestational diabetes and why it matters in pregnancy and what you can do to, as your part, as a client or patient, what you can do to help prevent it. I'll talk about some types of testing as well as just sort of the risks that are involved to you and to your baby. So let me just tell you a little bit. Basically, gestational diabetes is when, if you've never had diabetes before and you have high blood glucose or blood sugars in pregnancy. And basically, it's a condition where the body is unable to produce enough insulin to properly break down blood glucose or break down blood sugar. So without enough insulin, glucose can't leave the blood and be changed into energy. And there's some metabolic things that happen in pregnancy towards the middle, like 26 to 33 weeks in pregnancy. Your body starts to produce more estrogen and more cortisol, and with that becomes more likely to become glucose intolerant, where your body starts to not be able to break down the sugars, the blood glucose. And so, I think it's really a small percentage of people. I want to say, I can't remember. I don't have the numbers in front of me, but it's maybe 4 to 15%. It could be a little higher now. I'm quoting older numbers maybe, but that get gestational or have gestational diabetes. I think people are more unhealthy than they used to be, or have more history. Like if you have a history of miscarriage, if you are overweight, like have a higher BMI, you are over 30, you're of a certain race, if you are African American, Native American, Asian American, Pacific Islander, Latina, you are more likely to be at risk for gestational diabetes. Also, if you have diabetes, or if that's something in your family as well, that puts you at higher risk. So that's kind of what gestational diabetes is, and some of the risk factors, and basically some of the signs and symptoms, like that you would know if you know that you have it or possibly have it. Obviously, you're going to be tested for it between the 24th and 30th week. I would say most practitioners test for it around 28 weeks, just because it's kind of right in the middle, where these changes really start to take place. Yes, some of the signs and symptoms: you could have fruity breath, you could have increased thirst or the increased need to urinate, polydipsia, polyuria, that's polyhydramnios, that's more like amniotic fluid than necessary, so excessive or in excess of amniotic fluid. You might have frequent urinary tract infections. I'm trying to think of the other ones. Recurring yeast infections, or maybe your fetus is measuring large for dates. So one of the things that's a complication with gestational diabetes, one of the reasons why we test for it, is because it can make your baby super large, or what we call macrosomic. And what happens is, if the baby is super large, then it's harder for them to come out. And sometimes their shoulders can get stuck behind the pubic bone or the outlet, so inlet or outlet dystocia. And in the hospital setting, what they would do is use vacuum extraction. In the past, they use forceps, and if they still are having a hard time, then they would do an episiotomy. And many times If you even have a hint of gestational diabetes, they might want to do an induction, or they might want to schedule you for a C-section if they think the baby is super large. So those are some complications and some not so great things, you know. You're at risk for cesarean birth, for stillbirth. There's research that shows that if blood sugars are at a certain level fasting, it increases your chance for stillbirth, specifically the further along you are. Hypertension, so high blood pressure, preeclampsia, that's a condition usually after the 32nd, 34th week and beyond. That can be really an issue for mom and baby, but can lead to eclampsia, seizures. It's like a blood concentration of your blood, and your blood pressure spikes. You can have seizures, you can have aneurysm. It can be pretty bad. And then also you have a chance of developing type 2 diabetes outside of pregnancy, so postpartum, as well as your infant later in life developing diabetes. So also the baby kind of immediately postpartum can be hypoglycemic, because they've become so dependent on insulin, they are so dependent on glucose that they produce a lot of insulin to try and break it down. But then if they're not getting enough, dietary sugar, so from breastfeeding or from formula, then their blood sugar will tank. And so that's not great for them. They can develop respiratory distress, that kind of thing. So those are the reasons why we're testing for it. That's why it's a big deal. Basically, in home birth, we offer you the screening. We tell you the risk and benefits to screening. It's recommended to do blood sugar testing, a fasting, or a random test where you've just eaten your normal breakfast, and then we test after you've had a 50-gram sugar drink an hour later. So there's that test, and then we also, my favorite is home monitoring, which I already talked about in another video that I do. But basically, home monitoring is where you take home a sugar machine, and every morning you would test yourself fasting, and then you would test yourself 2 hours after you eat. Some people do 1 hour after you eat, and then again at 2 hours after you eat. And we're looking for certain numbers that let us know that your body is breaking down sugars effectively. If not, what I do is I have you do a food journal where you're writing out what you're eating. And so if your numbers are out of balance, then you know that you can make an adjustment to that. Also, making sure that you are exercising, because exercise actually brings glucose into the cells and uses them for energy. And you're more likely to do well, to get those numbers down if you're exercising. And I don't mean extreme exercise. I'm talking about taking an evening walk for 15 to 20 minutes, nothing crazy. It's recommended that if you were exercising outside of pregnancy, to continue doing what you were doing, maybe moderate or adjusting it somewhat. If you haven't been exercising, then you can add walking, because you're already walking. Just increase that walking and try to get your heart rate up. So changing your diet as well can help. But I forgot to tell you, so self-testing and evaluation with the 1 hour test. Some people go ahead and do the GTT, which basically is that the testing at 1 hour, 2 hours, and 3 hours. And the first test that they do is like a fasting. So you fasted overnight, you go in the morning, they take your blood sugar, and then you drink a drink. They take it an hour later, 2 hours later, and then 3 hours later. And that lets them know, that's more definitive as far as how your body handles blood sugars. So there's a few different ways to test, and my preference obviously is the self-testing. And then basically, that lets us know what you need to tweak. If we've done the testing for a week and then we've tweaked some things and we do it for another week and things are still out of balance, your blood sugars are still too high, then we go to a consult with a maternal fetal medicine doctor, and you might have to go on insulin, self-administered insulin. And some people, this rules out for home birth, and other people it doesn't. It just kind of depends on the situation. But usually we can tweak your diet enough and implement exercise to get your levels within a normal range. I wanted to show you this book. It's by Lily Nichols. She is a registered dietitian. It's called Real Food for Gestational Diabetes. She has another book called Real Food for Pregnancy, and they're both really amazing. But she tells stories, gives you information about self-monitoring, as well as gives you sample meal plans. These are really great because some people are like, I just don't know what to eat. And then also she has recipes in here. So I recommend this book. I don't know if you can get it at your library or if there's an online version, but it's not too expensive. You can get it on Amazon. But yeah, I've found that really kind of a low carb diet, or eating foods that are lower on the glycemic index, so sticking with your protein and veggies, eating fruits in moderation, and then eating foods that are lower on the glycemic index. Like if you're going to have a piece of bread, have sprouted bread. If you're going to have a potato, have half of a sweet potato, some black beans, brown rice, quinoa. And, try that out, see what happens as far as what your blood sugar levels are and how it's affecting your blood sugar. So if you continue to have higher levels, that means that's how much glucose is hanging around in your bloodstream. That's what baby's getting used to. And we want your levels to be within a normal range, not spiking and not staying high, but staying within a normal level. And that's going to help keep your body healthy, keep baby's body healthy. So if you have any other questions for me, let me know. Send me a DM or hit me up at info@wildfigbirth.com. I'd be happy to answer your questions. I hope this helped. Obviously, I'm not an expert, but I know a little bit. I'm just sharing what I know. All right, guys, I hope you're well. Happy birthing and happy pregnancy to you.